Welcome to the 2.0 conference in Las Vegas, Nevada. I'm here with,
Dr. Paul Dyer.
my name is V. Can you tell me more about your um, organization?
Well, so it's not really an organization, but I am the CEO of Whole Life Health,
Okay.
right? But for me, I am a neuroscientist along with a physics. So I combine how AI is going to be introduced into the brain so we can
Oh,
help
wow.
with our mood disorders,
Wow.
right? So I know that seems like to be a scary thing when we talk about implanting things into the brain, but we could do it where it's not so much of as a weapon, but more as a humanistic way. Because I know people are going to be afraid of introducing things into their body, especially foreign things, right?
Yes.
But we are losing the battle when it comes to mood disorders. And the one thing that we need to start accomplishing is because so many people are so emotionally reactionary, right? And along with the different things I teach emotional responses. But that's very tough when people are unbalanced for all kinds of myriad of reasons, or different factors, environmental factors, genetic factors, or just sensory factors that they don't know how to. And I don't like to use the word control, right? Because control means to be a power over.
Yes.
I think we can live with nature as a symbiotic relationship. And understanding how the neural cell works, how to understand brain chemistry works, understanding how things can work against you, then you can help with balancing out who you are. So that's what my research is. That's what I do. I'm a veteran, right? So helping people to reprogram themselves into a better way of how they can live is really what my passion is.
Well, thank you for your service.
Oh, absolutely.
And where can others reach you for your collaboration?
They can reach me if they just put in Dr. Paul W. Dyer. You can find me.
Oh, okay.
If you want to find me, you can find me, right? But LinkedIn and all that other stuff is really cool. Yeah, I do YouTube podcasts and things like
Yes.
that. But it's really about what we need is collaboration. We just don't need everyone to be a lone wolf, because the way healthcare is going, it has been only used for the people who can afford it. And I don't think healthcare should be only used for way people can afford it.
Yes.
I understand there's different modalities out there where it could help you feel calm and safe, and there's some really great things out there. What I do is I explain the science of how it works, the way meditation works. I explain how the cells work in the science. I explain the chemistry of how it works in the science. I explain how the body reacts because of the cell and how it forms. So I think people are still doing some amazing stuff, but I think if they had a personal connection to how it's working, I think whatever they're doing would enhance it.
And how do you feel about if someone's asking you to follow their footsteps, to follow your footsteps? What advice would you give them?
It's not, my advice is to be inquisitive, but that's so hard for people to do because they lack intention. To be intentional and to be inquisitive means when you ask yourself a question, ask it. Don't think just because you don't know the answer, seek a better question so you can get better answers. Because once you get a better answer, you're going to ask another question. So, and that's intentional. So, to follow my footsteps, for me, it's to be intentional. Maybe that came from my training. Maybe that came from just my passion of helping people and the humanity that we live in, because we're falling apart. As a collective of human beings, we are on one side or this side. We live here, you don't live here, you make this, you make that. And yet we separate ourselves by these different materialistic things, and yet we are living unhappily. So I think the best way to do it is be intentional about who you are. But if you don't know, find out and ask for help.
And how's the experience of the conference been for you?
Yeah, it's been great. You know, being recognized at the Health 2.0 conference, at the Health Excellence
Congratulations.
Award. Yeah, it's really amazing, especially for me coming from humble beginnings as a New York kid, and just it's I come from a different road, maybe just by being a black male in the United States, or you just being a black male. But I think being here to have a platform to meet wonderful people and to talk with other amazing, innovative people to say like, yeah, let's move this forward. And I think that's what this conference is. It's about everyone's moving something forward. And again, it's just, if we could come together as a unified, because we're all trying to make something
Yes,
better,
I agree
right?
with you.
So it's not like we're on different buses, right? So if we can get on the same bus and collaborate, and that's what this conference is, it's a collaboration of moving something forward. I think that's amazing, and that's what I found so far with meeting some amazing
Well,
people.
I'm glad that you're doing well and that you actually enjoying the convention.
Yeah.
And I hope to see you next year. And we're gonna have another convention in December, and then the next one will be in January.
Okay.
It's Dubai, Singapore, and Las Vegas.
There you go.
Yeah. Thank you.
Thank you so much.